I've been taking statins for 2 months now. My doctor prescribed them to me. And I've been taking statins for 8 years. And my doctor told me to take statins for life because I had vascular surgery. But I don't want to take them. So how can you stop taking statins and do it correctly to avoid side effects? Today, we'll break this down step by step in this video. I'm Dr. Vasyl Chaika. Let's get started. It's impossible to stop taking statins abruptly because any medical drug has a feature called withdrawal syndrome. Statins are no exception. That is, for example, if you have been taking statins for several months or even years and you suddenly stop taking them, your cholesterol level will spike sharply, which can actually be life-threatening. That's why it needs to be done correctly. And now, let's go through step by step how to do it correctly. There will only be a few points. So let's start with the first point. Could it be stopping statins? No. The first thing you need to do is change your mindset so you understand that statins and cholesterol are two different things. Statins are a negative element, while cholesterol is, was, and always will be positive. But you might ask, where is the evidence? Where is the evidence that cholesterol is a positive factor in our body? After all doctors unanimously say that cholesterol is negative. It clogs the blood vessel. And here you need to know the history. The first person to develop the theory that cholesterol is harmful was Virchow. And that was more than 150 years ago. After that, in 1913, two scientists, Anichkov and Kalatov, also supported and slightly modernized this theory, proposing that it is specifically the increase in cholesterol that is the cause of atherosclerosis. Then, in 1976, a doctor and scientist named Ross, and later in 1997, they also built their theories on Virchow's teachings. But Virchow wrote in his works that you are mistaken. My knowledge at that time was still being interpreted incorrectly. I quote, "Cholesterol is not harmful," these are Virchow's words, "and it only increases when the blood vessels are healing." In other words, Virchow said the following: an increase in cholesterol is not a bad thing, and it only rises when there is an inflammatory process somewhere in our body and the healing process is underway. That is, cholesterol is necessary to complete the inflammatory process. And statins do not allow this process to be completed. Just so you understand, it's like an analogy with pothole repairs. After spring, when the snow melts, we have a huge number of potholes on the road. And ideally, all of this should be properly patched up. A repair crew arrives, everything should be patched up, or better yet, the asphalt should be removed and replaced with new. That's exactly how our body works. But then, corrupt officials show up, there's some budget allocated by the state for all this, and they pocket it for themselves. So in fact, who are these embezzlers in our body? The statins that we take. They prevent the process from being completed physiologically. But in order for you to keep taking these statins, they tell you a fairy tale that you'll die without them. Do you see the analogy? Doesn't that remind you of our own corrupt officials? No, not different thoughts. Please, draw the analogy. But let's look at the facts, the real one. If, for example, a person takes statins or, say, follows a diet that reduces, for instance, the intake of cholesterol into the body, then of course these people should live longer and better. They shouldn't have heart attacks or strokes. If it's, for example, the president or some other ruling elite, they have the best doctors. Let's turn to history. The 34th president, Dwight Eisenhower. When he had his first myocardial infarction, his chief physician, Dr. White, recommended a strict anti-cholesterol diet with limited animal fats. His assistant, Dr. Burns, was against it because he explained, "You're mistaken, it's very easy to find." What was the result? The stricter the diet that excluded foods which stimulate bile flow and those that contain cholesterol, the more Eisenhower's cholesterol level increased. The stricter the diet, the higher the cholesterol. As a result, he suffered several heart attacks and he died. Here's another very interesting fact. Let's take India, a huge country, northern India. There, people consume animal fats, which contain a lot of cholesterol, 17 times more than in the East. But interestingly, the number of heart attacks and strokes caused by atherosclerosis in the northern part, where there are many foods containing cholesterol, as we've been told, is 7 times lower. Another very important thing you should know is that such a study was conducted. It's also known as the risotto effect. There is such a town in Italy, and there was a doctor from Oklahoma, Stuart Wolf. He studied this town. It was a closed-off town, so to speak. More than 2,000 people lived there. What was interesting was that in this town, people would seek help for heart or vascular problems. People who were older than 65 years. Before that, no one had ever sought help. When he started studying them, he saw that they practically had no problems with atherosclerosis. Maybe they were on some strict diets. No. Maybe they were taking statins. No. They lived a certain kind of life, a simple life. And they basically followed those things intuitively. The next points, which we are about to discuss right now. So, point number 2, what we need is to reduce the impact. What we call stress in any of its forms, plus reduce what we call low self-esteem. That is, we need to raise our self-esteem. We should always be satisfied with ourselves, praise ourselves. The problem people have is that they live with expectations. Like a son-in-law, for example, should treat his mother-in-law a certain way, or a husband should treat his wife a certain way, or a boss should treat me a certain way. These are our desires. But reality is completely different because people grew up in different circumstances. And they essentially carry their own culture with them. So it's actually a matter of culture, essentially. And when you expect a teacher or you expect the president to act the way you want, that's not a real expectation. He will act the way he thinks is right, not the way you do. And then you get offended. You think, I'm not like that, everything is bad, and so on and so forth. So in order not to live in stress, you need to learn to accept reality as it is. How do you do that? You need to stop expecting. Everything that is happening to you today is real. Everything you want to happen, everything you think about, everything you wish for, that is not reality. And the bigger this gap, the more stress you will actually experience. Another very important element is to be satisfied with yourself. And taking the first point into account, not to worry about the fact that, about those statins and about that cholesterol. Yes, you are taking them, but you can get off them, and we are going to discuss this with you now. Another important thing is that you need to understand one very important point. Cholesterol itself has always been, is, and will be a positive element. Cholesterol, for example, just so you know, cannot migrate through the body on its own. There are special little trucks that transport it. These trucks are lipoproteins. So there are the norms for total cholesterol and for high density and low density lipoproteins. When cholesterol enters the body with food, high-density lipoproteins load this cholesterol onto themselves and transport it directly to the liver. In the liver, they deliver it, having done their job, and then this cholesterol that has arrived is converted into bile acids, which are then secreted in the bile. These are necessary for bile, so that the enzymes of the pancreas are activated, so that digestion is proper, so that there is no dysbiosis, so that parasites do not live, so that there are no problems with the knee joints, and so on. In other words, we need this. And here's another important point. And free cholesterol is formed. This free cholesterol, this material, is loaded onto other carriers called low-density lipoproteins, and these carriers transport it to the area where there is inflammation. It doesn't matter where the inflammation is. Whether it's the vascular wall, the ovary, or carious teeth. It doesn't matter where the inflammation is in the body, low-density lipoprotein is drawn there. It carries cholesterol there. That's why cholesterol is not bad. It only indicates that there is inflammation somewhere in the body, and in order for this inflammation to resolve, more cholesterol is needed. The higher the cholesterol, the better the repair processes go, which do not pose a threat to the body. So what is the logical third point? We need to stop chronic sources of inflammation in our body. Maybe for someone it's the ovary that's inflamed, for someone else it's a finger, for another it's the teeth, or something else entirely. In other words, we need to stop chronic sources of inflammation. And then what? Cholesterol will also decrease on its own. Since part of cholesterol is excreted in bile, and what is very important is that cholesterol cannot be eliminated by the kidneys, the body regulates cholesterol levels. If there is an excess, for example, if it is no longer needed or has already served its purpose, it is expelled through the bile. So what happens when there is bile stasis? The cholesterol level will also increase. So what do we need to do? Using methods known as, for example, visceral therapy, we improve bile flow by opening all the sphincters. And once we've done that, the next step is to consume foods that stimulate bile flow. What are these foods? You should consume them daily. These are foods that are a bit fatty, a bit spicy, a bit sour, and a bit salty. That's enough. So, what are these foods? We've already talked about this. And now we move on to probably the most important point. These are biological, natural remedies that also help normalize cholesterol levels. How? By eliminating chronic sites of inflammation. So, what is this miracle? These kinds of products? Maybe these are some exotic products that need to be brought from India or Africa, or maybe, for example, from China. No. You know all these products, it's just that no one tells you about them. Remember, your health is right under your feet. One such substance is dihydroquercetin. This substance helps to speed up the resolution of inflammation, has anti-aggregation properties, and actually helps fight inflammation. Where can you find this dihydroquercetin? Yes, it is available in tablet form. But just so you know, it's actually milk thistle. So if you take milk thistle daily, what does it help you with? It helps improve bile flow and also normalize cholesterol level. The second product, which you all know about as well, is called resveratrol. But that's just the medical name. Where is it found? You also know this product very well. It's red dry wine. That's exactly where this substance is found. So if you take it daily, you can do this. If, for example, your cholesterol level has increased or you have some kind of chronic inflammation, then 2 grams per kilogram of body weight per day of dry red wine will act as medicine for you. Of course, some people say, oh, that's too much, I don't drink alcohol at all, and so on. Remember, the difference between medicine and poison is the dose. And, of course, if you take 4 grams per kilogram of body weight per day of dry red wine, that will no longer be good. That will already be poison. But at a dose of 2 grams per kilogram of body weight, you can take it daily, for example, before bed, and for you, it will be medicine. And now we move on to the section where we discuss how to properly discontinue statins. So, when you already understand that cholesterol is not harmful, you understand how to manage stress, and you have normalized bile flow. You eliminate chronic foci of inflammation, you take additional biological, natural, and herbal remedies that also help the body suppress chronic inflammatory processes. Now we can move on to discontinuing statins. This is done as follows. If, for example, you are taking a certain dose, let's say 40 milligrams, or 80 milligrams, or 20 milligrams, it doesn't matter which statin, whether you've had vascular surgeries, often heart surgeries or surgeries elsewhere, or if your cholesterol just went up, it doesn't matter. What should you do? You take this dose, reduce it by half, and take this reduced dose for 2 weeks. Then you reduce the dose by half again. For example, if it was 80, you take 40 for 2 weeks, then for the next 2 weeks you take 20, which is half again. The third cycle, again, 2 weeks at 10. The fourth cycle, again 2 weeks at 5, and only then do you completely stop taking statin. Remember that a gradual discontinuation of statins prevents the syndrome from occurring, the rebound effect. It's called withdrawal syndrome. We are very gradually releasing this spring. We are working with the factors. In fact, we are normalizing the body's function and reducing the inflammatory process. Then the excess cholesterol is no longer needed and it returns to appropriate levels. So use this algorithm. Live long and happily. This was Dr. Vasyl Chaika with you. Only a thinking person can be healthy in today's world.